Hello, my name is Becca. I'm the engagement lead for the Cheshire Merseyside Women's Health and Maternity Program. This week is Black Maternal Health Awareness Week 2024. It's the 5th awareness week that 5 times more have created. Each day has a different theme, all under the overarching goal of advancing Black maternal health. Today's theme is pregnancy and disability. To discuss this, I'm joined by my colleague, Jo Hunt. Jo is the lead midwife for health inequalities. Hi, Jo. Thanks for joining me.
Hi, Becca. So, as you've already said, we're going to be focusing on disability and long-term health, maternity care if somebody did have a disability or a long-term health condition. So we'll talk what reasonable adjustments are, how you can ask for these, and particularly pertinent for this week and the theme is also how you would access an advocate or support if you felt that you weren't being listened to, if you did have a disability or long-term health condition, or how you can go about asking for this support or reasonable adjustments to be made.
Great. What right do I have to NHS maternity care?
So everyone's legally entitled to maternity attention from healthcare professionals during pregnancy, childbirth and postnatally, which is the period after baby's born. And it's really to ensure that everybody has a safe and healthy outcome, both for mum and baby. Sometimes serious and occasionally life-threatening complications can occur in pregnancy and childbirth. So we really want to ensure that all women have access to safe maternity care. And human rights mean that you must be treated with dignity and respect during your care, regardless of any disability or long-term health condition.
So do I have the right to additional support during my maternity care if I'm disabled or have a long-term health condition?
So this is supported by human rights laws and equality laws as well. It will ensure that you do have a right to additional support during pregnancy and childbirth if you are disabled. So equality law describes disability as a physical or mental impairment that can have a substantial and long-term negative effect on your ability to do normal daily activities. So this can be physical disability, sensory, learning impairments, but it can also include long-term health conditions. So if someone had epilepsy, etc. So if you have an impairment or a long-term health condition that meets this description, even if you don't identify as disabled, you do have the right to additional or different support during your maternity care. And your maternity care must be safe. It must support your needs, respect your dignity, and allow you also to have input and to make your own decisions. And you can't be discriminated against because you're disabled. So if you are disabled and need different or extra support during pregnancy and after the birth, you do have the entitlement to talk to your midwife or other healthcare professional and be able to plan the support that you need. And your NHS trust should make reasonable adjustments to make sure you can access the same maternity care as everyone else. And this is covered by the Equality Act of 2010.
Okay, so what are reasonable adjustments and what can I ask for?
So again, this all links back to what the long-term health condition or disability is, Decca. So for instance, it could be quite simple. If someone was disabled and needed access to a disabled toilet or shower or particular aids, it could just be a simple adjustment of space. For instance, if someone was a wheelchair user, it could relate to visual impairment where they may need large print information, or it could even mean that somebody would need translation services or information given them in a format that they would understand, particularly someone with a learning disability, etc. It may mean that you have to adjust the environment. We may need safe lighting and appropriate lighting for someone to be able to lip read, or lighting that wouldn't cause someone pain or discomfort if they were sensitive to light. Possibly longer appointments could be needed, the use of an advocate or communication support. And often what can be quite helpful is tours of the birth centre or birth location, and this could be particularly useful if someone was neurodiverse. Often they will like to see the environment in which they're going to give birth in, and that can really help to be able to familiarise themselves with locations. So that could be really good to put a tour of the unit in, or even just the birthing room or the birth centre, etc. It could be an opportunity to try getting in and out of a birthing pool, or just seeing if there were any other support you would need with that, depending on your disability or long-term health condition. It could be plans to minimise the noise if that was something that would cause distress, or even having additional support or additional birth partners, both on the delivery suite or the postnatal ward. So really, it all goes down to the individual, and it's important to mention that one person with one disability is one person with one disability. Just because that those needs have been met for somebody else, it doesn't mean that the next individual with that similar or same condition will need that. It's all about personalised care, really getting to know your midwife, and your midwife really getting to know you at the very beginning, the booking appointments, and to be able to discuss what those reasonable adjustments are. What can we do to support you? What can we do to help? And ensuring it's documented, and that other health professionals know, and that it's really the individual is at the core of it, and it's adjustments that will really benefit them to have that safe experience, and improve the outcomes for both mum and baby as well.
That's quite a large variety of supports there. What if I'm not receiving the correct care or not listened to? Where can I go for help?
So there could be that there's input from other teams across the hospital as well, Decca. So if someone did have a particular disability or long-term health condition, you could ask your occupational therapist, your GP, or a consultant from a different field to be able to, speak about what those adjustments are and what you would need. If you really felt that, you were struggling to speak to your health professional, you could speak to another trusted health professional, or you could take an advocate or relative with you to your appointments who you feel, maybe make some notes prior to see if that's something that you could open up those discussions to see what you need, what the concerns that you're having about your care. If you did feel that it was something that was a little bit more serious and you weren't being listened to at all, or you didn't feel that your healthcare professional was listening to you, it's particularly important to ensure, as I've said before, about safe outcomes, to make sure that the care is suitable for you. You can escalate this. You could speak to your patient advice and liaison service at the hospital, PALS, and they will help you raise concerns to the head of midwifery or maternity teams. You could speak to maternity and neonatal voice partnerships, who again can advocate on your behalf. With this, there's organisations such as Maternity Action that can help if it was for instance, it was an employer-related concern for disability and pregnancy, and they weren't making reasonable adjustments, so they can help with things like that. We also have birthrights.org. There's lots of information on their website as well as to how you can raise concerns, or even just ask. A lot of the time it is just communication and just being able to get your voice across. I appreciate as a midwife myself, that can be quite difficult for women sometimes to be able to do that. So again, it's using peer support or a trusted community member or someone that you trust to be able to help you raise those concerns. I think the important thing to remember is that there is help out there. You don't have to suffer in silence. You're absolutely entitled to that care and support, and reasonable adjustments to be made, and for your care to be personalised to you. So always raise those concerns and speak to somebody.
That's fantastic. Thank you, Jo. And I do hope that people will come forward, listen, and say what they need and come forward. Thank you, Jo.
Thank you, Decca.